Of the three most common things I saw in my research, the 653 women, there were nipple trauma, breast engorgement and mastitis. They were the most common occurrences. So most of those can be dealt with depending, of course, with mastitis. If it's due to an infection, that may be needed to be treated with antibiotics, and it's really important to do that to prevent abscess formation. And if you get to abscess formation, it definitely has to be treated with antibiotics. So to prevent all of those, it goes way back to the first breastfeed again, and the things that we've talked about before pertain to preventing early mastitis. And it was mostly early mastitis that I saw. I did see some late mastitis, and it was sometimes women had all three things. They had nipple trauma, they had breast engorgement, and they had mastitis as well. So the inflammatory process had begun. So the important thing there is to encourage the milk to move through the breast, whether that's by the baby feeding or whether that's by using a breast pump to get the milk moving through the breast to reduce the inflammation. Cold compresses can help reduce the heat of the breast, but the most important thing is to drop the inflammatory process. Mastitis can occur any time where there's milk stagnant in the breast. So if, for example, the baby sleeps a long sleep at night and you haven't experienced that before, and then you wake up in the morning with a painful breast, it's red, then that's the beginning, the inflammatory process. So it's really important to get that milk moving through the breast. It's just a change from what has been happening on a regular basis, so your body's adapting. If ever your breasts are too full or uncomfortable, it's really important to move that milk through your breast, either by the baby or by expressing some off. You don't need to drain the breast because all that does is reproduce more milk. But what you need to do is make the breast comfortable so that the whole process between the brain and the breast is that there's milk moving through the breast all the time. So mastitis can be a complication when babies are starting to wean as well, and the milk gets left in the breast, you get busy, you're going on doing things, the baby slept all night. A lot of reasons, but really it's very important to keep that milk moving. You don't need to again express a lot, but keep it regularly moving through the breast until it starts to slow down. So to prevent mastitis, which is one of the most common things that I saw with engorgement and nipple trauma, is to go back to basics again. Check that the baby's feeding from both breasts. Check that the baby's symmetrical at the breast. Check that the breasts are having milk move through them regularly. So, it depends on how old the baby is, how regular that will be, whether the baby's now on foods or not on foods. But it's really important, if you find any pain or any sensation of the flu-like symptoms, hot or cold, feeling hot and cold, shivery, that you check your breasts for lumps and that you make sure that you don't have any red inflamed area. That means the milk has to be moved through the breast to prevent a severe mastitis occurring.